So I've been writing a newsletter now for about 2 years, and every 6 months or so I send an update to my patients about how I personally am doing. I'm a surgeon, performed somewhere around 3,000 joint replacements, and ironically I'm a surgeon who gets right hip pain. Part of what I'm doing at the moment in terms of producing videos and writing newsletters about hip and knee pain is working out for myself how I can live the rest of my life by keeping the inflammation in my hip settled. And the three things that I look at is body weight, my activity levels, and how I move, all underpinned by some simple measurement. So up first, I've got my body weight going back over the last 2 or 3 years. It's often not a big problem for my patients or for myself, but what I've noticed is that even a 2 kilogram increase in my own body weight can be enough to increase the inflammation in my right hip. So it's something I've really pinned down to pay close attention to, and setting my target weight and a 2 kilogram buffer, and making sure, most importantly, that I'm measuring and paying attention to it. And you can see that the recent weekend barbecues have been taking their toll, and I've got a view towards the end of the summer, when I've got a target run in mind, of coming back down to that clear target weight. So that's body weight. Activity next, and my Google Sheet, which I'm going to share in my upcoming series of hip and knee courses, now goes back a few years. And what I've worked out is the importance of scaling up my activity slowly before any target event, allowing periods where I can take it easy on holiday, but making sure that I'm keeping my activity levels ticking over. And it's that last point that's made a real difference. Really cutting out any boom and bust in my activity levels. And two things help me keep on track. If I didn't run or bike yesterday, and I want to get out and do something today. And I'm aiming overall for about 25 miles per week. So somewhere around 40 kilometers, and that's adding my running distance and a third of my biking tally, my biking distance. And I find that that level of exercise is anti-inflammatory for my hip, and also keeps the strength around my hip good, so I'm less likely to jar that hip. So that's body weight, activity, and the final thing is movement, underpinned by good measurement, so another M. I really need to avoid deep hip flexion. So I think I've got a slight deformity in my hip that's led to a labral tear, and I need to avoid bending that hip right up so that the ball hits the edge of the socket. I want to cut that out of everyday life. I've developed a sort of zero tolerance approach to that. If I'm down on both knees with the kids, I go to get up just using my bad right leg. Every time I'll force myself back down and to get back up with my good left leg. And that's made a big difference to me. Also being careful when I'm digging the garden and making sure that I pace myself with that and not do too much all in one day. Try and space it out a little bit. So how has that gone for me? Well, part of the measurement you've seen already in terms of body weight and activity levels. The other thing I measure is my pain, function, and well-being scores. My pain and function is an Oxford hip and knee score, where you fill out a set of 12 questions, a few of which are here on the left, and that produces a score out of 48, but you can turn that into a percentage. And if I chart that over the last few years, and those little dips in the graph show when my pain and function score drops. So when I'm getting pain in this hip. And what's being key is trying to increase the space between those dips, between those painful episodes. So I had a little dip over Christmas, which coincided with a drop in my activity and a blip up in my body weight. But otherwise, over the last 12 months, I've been pretty good sticking to my target body weight, or within a couple of kilograms, keeping my activity levels somewhere around about 40 kilometers per week, running and cycling, and making sure I'm careful to avoid deep hip flexion, the movement. Hopefully, these tools are going to let me hang on to my hip, and I hope that by sharing this, that gives you some insight into how you can help yourself. Good luck.